أهلاً بيكم يا دكاترة في شرح النهاردة. Today we're diving into a really crucial clinical masterclass. We're breaking down Dr. Shamet Haney's essential lecture on diagnostic tests, and more importantly, the absolute non-negotiable responsibilities you hold as a nurse. Let's be real, our role goes way beyond just taking vital signs, right? We are literally the architects of clinical accuracy. So grab your coffee, bring your premium focus, because this explainer isn't just going to help you master the core concepts perfectly, it's going to make you completely 100% exam ready. عشان نكون منظمين وما نتوهش من بعض، هنقسم شرح النهاردة لأربع أجزاء رئيسية. First up, Section 1 covers our intro and definitions. Then, Section 2 is all about nurse responsibilities. Section 3 is going to tackle influencing factors. And finally, Section 4 will guide us through the different laboratory departments. Let's get right into it. So, Section 1, Introduction and Definitions. Let's lay down the basics of diagnostic tests. Okay, before we ever even approach a patient with a needle to draw a sample, we have to deeply understand exactly what we're collecting and, honestly, why we're doing it. الأساسيات دي هي اللي بتفرق الممرض الفاهم جداً من الممرض اللي مجرد بينفذ خطوات وخلاص. Let's start with the absolute baseline. What actually is a specimen or a sample? Well, academically speaking, it's a piece or a small amount of something to be tested that shows the characteristics of the whole. يعني كلام ده يا شباب ببساطة يعني لو أخدت نقطة دم صغيرة جدا النقطة دي بتعبر عن حالة الدم في الجسم كله. It's like a snapshot. It gives us the entire clinical picture of the patient's body using just a tiny fraction, whether that's blood, urine, or stool. Now, listen up. ركزوا معايا في النقطة دي كويس جدا عشان بتيجي في الامتحان كتير. A biopsy is fundamentally different from a regular specimen. A biopsy is a small sample of tissue or cells taken from the body to be examined. الفرق هنا جوهري يا دكاترة. While a regular specimen is usually a fluid or an excretion like blood or urine, a biopsy involves actually taking a physical piece of tissue. It's a completely different, much deeper level of anatomical sampling. So, ليه أصلاً بنعمل diagnostic tests? What's the real importance here? Well, first off, they provide vital information about the individual's state of health. Second, they confirm a diagnosis. But the third point? This one is absolutely crucial for us as nurses, to evaluate the outcome of therapy. إحنا مش بس بنشخص المرضى خلاص، إحنا بنشوف هل الأدوية والتدخلات بتاعتنا فعلاً بتجيب نتيجة مع المريض ولا لأ. And remember, diagnostic tests aren't just about fluids. They include metabolic tests, electrical impulses like the ECG for the heart and EEG for the brain, and even X-ray examinations. It's the whole shebang. Moving on to Section 2, Nurse Responsibilities. This is where your crucial role really shines. Guys, this is where you step in as the ultimate patient advocate. You are quite literally the most vital link in the diagnostic chain. لو الممرض ما عملش دوره صح، كل مجهود الدكاترة والمعمل هيضيع على الفاضي. Let's break down your timeline of duties step by step. Step 1. Obtain the patient's consent according to hospital regulations. لازم المريض يكون موافق الأول. Step 2. Schedule the procedure with the responsible department. Step 3 is massive. Prepare the patient psychologically and physically. And Step 4. Prepare the equipment and material needed. تخيل معايا السيناريو في المستشفى كده. انت بتاخد الموافقة، بتحجز الميعاد، بتهيئ المريض نفسياً وجسديا، وبتجهز أدواتك كلها قبل ما تبدأ أي حاجة. طيب، يعني إيه الكلام ده يا دكاترة؟ Let's unpack that physical preparation part. Physical preparation involves reminding the patient about strict measures. For example, fasting before a fasting blood sugar test. دورك هنا مش مجرد إنك تقول المريض يصوم وتسكت. دورك إنك تتأكد إنه فعلاً صايم. Your critical role in enforcing these fasting rules is exactly what prevents completely skewed, inaccurate metabolic data from reaching the lab. Okay, and what about your responsibilities during the actual procedure? First, support the patient and inform him about the steps. No surprises. Then, distract his attention against the pain through talking.
خليك جنبه، اتكلم معاه عشان تنسيه وجع الشكة.
But most importantly, observe the patient's reaction clinically. You must monitor for signs like an increased pulse rate or pallor. Pallor يعني شحوب فلون الجلد، وده مؤشر خطير إن المريض ممكن يكون بيعاني من ألم شديد ولازم تتدخل فوراً.
All right, Section 3, Influencing Factors. Let's talk about ensuring lab accuracy.
Here, we really need to shift our focus to strict protocols. You absolutely need to be aware of the clinical variables that can completely ruin a lab result if you ignore them. غلطة صغيرة هنا ممكن تدينا نتيجة وهمية تأثر على مسار علاج المريض كله. Why do we insist on fasting and timing? Well, specifically, a 12 to 14 hours restriction is strictly required for a fasting blood sugar test. صيام المريض ذي المدة دي بالذات مش اختياري. It is an absolute, non-negotiable physiological requirement. Think about it. If the patient sneaks a sandwich just 2 hours before, their glucose levels will spike, and the doctor might wrongly diagnose them with diabetes. No way we can let that happen. The next major influencing factor is drugs. For instance, with common medications like aspirin, patients may be required to avoid the intake of certain medications before the test. الأدوية ممكن تغير كمية الدم تماماً وتأثر على النتيجة. That's exactly why it's your responsibility to meticulously check their medication history. You literally have to ask the patient directly, "أخدت أي أدوية النهاردة?" before proceeding with anything.
And finally, Section 4, Laboratory Departments. Let's see exactly where these specimens go.
For our final section, we're mapping out the actual journey of the specimen. العينة بعد ما بتسحبها من المريض بتروح فين بالضبط? Well, diagnostic tests may be done in a few different settings. Sometimes tests are done right at the bedside, within the patient's unit. Other times, they require complex off-site machinery in specialized departments or distinct laboratories. المكان بيختلف حسب نوع التحليل والجهاز المطلوب. Let's methodically walk through this high-yield exam table because you'll definitely see this again. First, the hematology unit. This is where we study the physical properties of the blood, things like hemoglobin percentage, RBC and WBC counts, platelets, coagulation and bleeding time, and sedimentation rate. دي وحدة أمراض الدم. واضحة جدا. On the other hand, the clinical pathology unit handles the chemistry side of things, التحاليل الكيميائية, زي urine analysis, fasting blood sugar, blood urea, and electrolytes like serum potassium and serum calcium. You've got to know exactly which tube goes to which unit for sure. To finish up our department breakdown, let's look at 3 more distinct units. The microbiology unit examines any specimen for the presence of microorganisms. دي ببساطة وحدة البكتيريا والميكروبات. Then, the parasitology unit specifically studies stool specimens to determine the type of any ova or parasite. وأخيراً, the histology unit is exclusively dedicated to studying the biopsy of cells. Notice the sharp clinical difference here? Microbiology hunts for bacteria, parasitology hunts for parasites, and histology analyzes the actual cellular tissue biopsies we defined earlier. It's like a giant sorting puzzle.
And this brings us to a powerful, empowering summary of everything we've unpacked today. The nurse is the primary advocate and preparer, ensuring clinical accuracy from the bedside to the laboratory.
شغلك مش بس سحب عينة، شغلك هو ضمان دقة التشخيص من أول ما تقابل المريض لحد ما العينة توصل المعمل بسلام.
By mastering these concepts and protocols from Dr. Shimat Hani's lecture, you aren't just exam ready, you are clinical practice ready. I want you to keep this level of precision in absolutely everything you do on the ward. So what's your next step going to be? Thank you for joining me in this masterclass, and I'll see you in the next deep dive.